Yes, it's come to this. A makeshift hospital going up in Burlington near Toronto for fear the coronavirus will stretch regular facilities beyond capacity.
Right now, we are in the calm before the storm. We are essentially creating surge capacity based on the worst case scenario.
The new structure will house up to 93 patients, freeing up space inside the hospital for more intensive care beds. Right now, Joseph Brant Hospital only has 5 patients in the ICU from COVID-19, but plenty more are expected, and not just here.
There's very little separating what we will face here in Ontario from the devastation we've seen in Italy and Spain. Thousands of lives are at stake.
Those countries worst hit saw their intensive care units overwhelmed. Ontario has 145 confirmed cases in ICUs and 340 more suspected. The case count is doubling every 4 days, with a surge expected soon, 2 weeks after March break travel.
Sometimes in the next 4 or 5 days, some of them will be hospitalized and some of them may be going to ICU and be vented.
Ontario's total number of confirmed cases keeps growing steadily. Compare that to BC, where the curve is slowly starting to flatten.
You see that they are at peak, near peak. They've got this under control, and Ontario does not look that way.
There's a backlog for Ontario test results, plus a need for better testing in general, says this epidemiologist, comparing vulnerable patients to sitting targets.
If you're not doing good surveillance, this is like a shark swimming around under the surface of the water. You're only going to know about the epidemic once the paddle boats start disappearing. And that's the situation in Ontario.
There may very well be the need for more makeshift hospital wards elsewhere before it gets better. Thomas Dagg, CBC News, Toronto.
Okay, let's turn to Dr. Isaac Bogoch, an infectious disease specialist who's been helping us understand the pandemic. So, Dr. Bogoch, what is your understanding of where we're truly at? I mean, is BC really flattening? Is Ontario really getting worse?
It's kind of hard to know right now. And certainly we all hope BC is flattening, but I still think it's too early to be optimistic that that's the true trend that it's taking. And we're going to need a little bit more time to see if that's actually sustained. And similarly, in Ontario and elsewhere in the country, in Quebec and across the board, we are starting to see the expansion of diagnostic testing. And in Ontario, for example, we're watching our Ontario work through that big backlog of tests. So it's kind of hard to interpret these numbers in a meaningful way. And again, just like in BC, the real test is going to be what happens in the days and in the week and actually 2 weeks ahead. Only then will we really know if this is being flattened.
And when public health says to expect a rise in cases, what are we supposed to do about it?
I mean, we're just supposed to hold the fort and really practice our physical distancing measures so that we prevent community transmission of this infection.
Dr. Bogoch, thanks very much.
Anytime.